Covering the State House now, lawmakers have released a few details about their final state budget bill. We'll talk about the bigger picture in just a minute, but first, a closer look at one part of the bill, and that is increasing the cigarette tax by $2 a pack. Jessica Grunling shows us how much more a pack of cigarettes could soon cost.
I was diagnosed with breast cancer in 2013. Within a few months of that diagnosis, I have 3 friends that were diagnosed with lung cancer. 3. I am the only survivor.
Christina Yoder now works as a cancer policy advocate with the American Cancer Society Cancer Action Network. She also used to smoke.
But I think $2 would have stopped me.
Yoder says it's about time for the Hoosier state to increase its tax on cigarettes. Right now, it's 99 cents per pack. Only 12 states have lower rates than Indiana. Would a bump to $3 per pack deter people from smoking?
It's so hard to tell. I know it's very addictive. Tobacco is so incredibly addictive. We have all kinds of places for people to go if they have drug addictions or alcohol addictions. But if you have a tobacco addiction, it's like, too bad, deal with it, figure it out on your own.
According to the American Lung Association, every 10% increase in the price of cigarettes reduces consumption by 4% among adults and 7% for youth.
Reduce youth initiation, meaning young people will decide, it's not something that they want to do because they're more price conscious.
Tiffany Nichols is an advocacy director with the American Lung Association. Each year, they put out a state of tobacco report. Indiana received an F in funding for its prevention programs, level of state tobacco taxes, and ending all sales of flavored products. 14.5% of adults smoke in Indiana.
I would like to see the number under at least 5%.
14.5% may not sound like a lot, but the ACS says tobacco usage accounts for 34% of Hoosier deaths.
And $3.4 billion annually in direct health care costs. We can do better.
In Indianapolis, Jessica Grunling, WRTV.
That was part of the state's budget deal, which could get passed today. But the bill also calls for cuts to public health. In the last state budget cycle, public health received $100 million a year. In this budget, that number would decrease to $40 million a year. Also notable is that higher education would take a 5% cut to its operations budget, as well as its replacement and renewal budget. Lawmakers say that these cuts, along with the increased cigarette tax, would help reverse the state's $2.4 billion budget shortfall. If the budget passes, the legislative session could end today.